Welcome to the Radiology Vault, an open repository for radiology educational content designed for learners and medical professionals. Presented by the Michigan Medicine Department of Radiology.
Hi, my name is Gaurang Shah. I am from the University of Michigan Department of Radiology, and today I'm going to talk about bold imaging. A little introduction about what bold imaging is. I don't have any disclosures. Now, what is bold imaging? It's also known as blood oxygen level dependent imaging. So it's an acronym, BOLD, blood oxygen level dependent imaging. Now, as we know, that brain is unique. There is a very strong relationship between location, a part of the brain, and function of that particular part of the brain. There are multiple techniques to evaluate function, so we can clinically evaluate as we do during the strokes or tumor, epilepsy, etc. There are animal lesion studies, EEG and imaging can be done, and then direct intraoperative cortical stimulation, which the neurosurgeons do before surgery, is a very important gold standard examination of the brain. But at the same time, as a radiologist, the most important physiological imaging for us is PET and fMRI, or functional MRI. Now, what is functional MRI? There was a lot of hype about the scope of functional MRI. This is a cartoon from a friend of mine, Hemant Morparia, who himself is a radiologist. And it actually shows what TSA can do with you. So when you go to the airport, all you have to do is to subject yourself to fMRI, and they'll know right away whether your thoughts are good or bad. And this is just aspirational, but it shows how useful it can be. Uh, what is functional MRI again? So functional MRI is brain mapping, which uses a very special MR imaging to measure the quick and the small metabolic changes which will take place in the active part of the brain. So this is during a task, when the patient is performing a task, we map the brain, and the part of the brain which is activated during that task will be outlined by that particular examination. So we decide which part of the brain is responsible for movements or sensations or language comprehensions or speech or memory. Now, what is the basic principle here? Is that first of all, when a subject or a person starts to perform a task, there is a change in the brain activity. So what it does is that it leads to a change in the local brain metabolism, and that will lead to a change in the local hemodynamics. So when the change in local hemodynamics takes place, what happens is that blood rushes in. And what does blood contain? Mostly hemoglobin. So hemoglobin is a molecule which has 4 globin chains, and each globin chain contains a heme group. At the center of heme group, there is an atom. They can actually bind a ferrous atom, and the ferrous atom can bind with an oxygen, and that is what happens in the lung. When blood goes into the lung, it gets hemoglobin gets oxidized. So all the ferrous atoms will bind with an oxygen from the lungs, and then it will flow with the heart pumping to different part of the body, and we are interested in brain right now. So it will flow to the brain and then supply oxygen for metabolism. Now, whenever iron combines with an oxygen, the molecule is known as oxyhemoglobin. Now, oxyhemoglobin is diamagnetic, which means that it does not have delta B effect, which means that it does not have a magnetic signature. While deoxyhemoglobin, when it has already imparted with one oxygen ion to help the metabolism of the local part of the brain, that deoxyhemoglobin is paramagnetic. So if there is a deoxyhemoglobin molecule in that particular part of the brain, then the local delta B will go down. Now, let's understand a little in detail what we mean by that. What I mean is that oxyhemoglobin is isomagnetic with respect to the surrounding tissue, and the Chi is less than 0. So this is the little equation. When hemoglobin goes in the lungs, combines with oxygen, becomes oxyhemoglobin, which is isomagnetic. So it is kind of a bright. While deoxyhemoglobin is paramagnetic, where Chi is more than 0, And with the respect to surrounding tissue, it will appear to be a little darker. So what happens when a patient or a person enters the MRI machine is that they are subjected to a very strong magnetic field. This is what we call as 1.5 Tesla magnet or 3 Tesla magnet. They are enormously powerful magnetic fields to which you are subjected. And what is susceptibility is that when you add a non-uniform object to a larger magnetic field, you give rise to susceptibility or magnetic susceptibility. So that's an extra magnetic field uh, that happens in the material which is immersed into that external magnetic field. And those susceptibility artifacts, as you all know, will occur near the junction of the air and tissue, like ear canal, sinuses. And this variation can also take place around the blood vessels where there is deoxyhemoglobin because it is paramagnetic. So deoxyhemoglobin will affect the T2 star in the surrounding tissue and give rise to a dark signature. And that is known as susceptibility, as we all know. So T2 star effect, and this is little a graph of time versus magnetization. This is a sine graph. And what it shows actually is the T2 effect is the yellow curve or the maze curve, and the T2 star effect is this little orange curve. And the difference between the two is actually what is known as the susceptibility artifacts. So what happens during the activation of the brain is that there is actually a difference in the blood flow. So at normal state, when the brain is not working at rest, let's say there are certain amount of oxyhemoglobin and certain amount of deoxyhemoglobin, which are actually denoted by blue, and the oxyhemoglobin is red. But when the person starts performing a task and a part of the brain requires more oxygen, then body tries to supply more oxygen, capillaries open up, and what happens is that the blood rushes in with more amount of oxyhemoglobin. So whenever there is more oxyhemoglobin, then the magnetic signature changes. And that is known as blood oxygen level dependent effect or blood oxygen level dependent imaging. Now, this is the very first bold imaging. This is an iconic image published in 1990 in magnetic resonance medicine by Ogawa. And on the right side is the room temperature where you can see that there is some susceptibility because room air contains 21% oxygen, while when the rat is taking 100% oxygen, then there is more number of oxyhemoglobin molecules in the blood, and that has a bright signature because it is diamagnetic and not paramagnetic, and that is why it becomes brighter. Now, this is exactly the principle that we are using to perform functional MRI. So what is bold signal? In bold signal, the neural activity will increase, the blood flow will increase, the deoxyhemoglobin concentration will decrease, and the magnetic field homogeneity will increase, so it becomes brighter. So what really happens here is that we have this boxcar design. The signal change is only the tune of 2 to 5%. It's very strongly field dependent, and that's why we perform that in the 3 Tesla magnet rather than 1.5 Tesla magnet. And the lag time for response should be at least 300 milliseconds. It can be up to 4 seconds. So you have an on-off design of giving a task to the person or the patient within the magnet. And what happens is that imaging is done during these two different behavioral states. The control state is the rest stage, and the activation stage is when the patient is performing the task, and that is the activation state. And what the machine does is that it maps out the difference that the image shows in the activated brain from the resting brain. So the brain activation will depend on the design of the task, and the tasks are very carefully designed to isolate the function of interest. So for motor task, let's say you are tapping the finger, and the part of the brain which is responsible for the function of hand, which is known as hand homunculus, will be activated. And then with the boxcar design, what happens is that, let me go back. So with the boxcar design, what will happen is that the rest stage and the activation stage will have different magnetic signature. So what will happen here in terms of T2 star effect is that at rest, the activation will be different than at action. And that difference is what is known as the excitation difference. That is something that we will be mapping out. So in this typical boxcar design, where there is alternate activation and rest, let's say the test condition is reading words like banana, house, trees, or bottle. The rest condition is looking at some sundry symbols and not thinking. So that difference of activation will show up as a part of the brain which is working. Uh, Now the signal change is only 0.5 to 3%, which is very minuscule. Now, if you look at this graph, it actually shows you exactly how it happens. There is an initial dip when the brain starts working because initially it will use up all the oxygen atoms and you are left with deoxyhemoglobin. But after that, the body will compensate and then start giving more oxygen because the capillaries will open up and the part of the brain will be saturated with oxygenated blood. So this is the positive bold response. And then there is also a post-stimulus when the brain stops working. There is an undershoot, and then it comes to the baseline. Now, all this part we are not mapping. What we are actually mapping is the positive bold response. The time to peak is about 4 to 6 seconds after the stimulus begins. And then the post-stimulus undershoot actually is suppressed actually after the stimulation ends. So we are not measuring that. And all these positive bold response are mathematically added, and that is subtracted from the resting state. So let us see when we are doing this language task, what we want to do is to map out the areas of the brain which are concerned with the language function. And these are those areas. So this is the Wernicke's area, which includes the superior temporal gyrus, the supramarginal gyrus, and also the angular gyrus. And at the same time, the Broca's area will include pars orbitalis, pars triangularis, and pars opercularis. And all this will be mapped out on the brain. So what we are left with is a functional MRI image. And this is the bold imaging that we want. And here is a left frontal GBM. And what we see here is activation of the right-sided Broca's area. The Wernicke's area is actually lighting up bilaterally. And here is a parasagittal slice where you can see that the Wernicke's area and the Broca's area and the middle frontal gyrus, they are all mapped out vis-a-vis the brain tumor. But going into functional MRI imaging is going to be the next installment. Thank you very much for the patient listening. I just wanted to teach you what is bold imaging and how it is used to map out functional MRI. Thank you very much. Bye-bye.